So, obviously if someone has a terminal illness, there's all kinds of things that can be done in a hospital setting to try and alleviate the symptoms, to try and, if there is anything that can prolong life, then that's often done in a hospital setting. Another approach to dealing with terminal illness is what's called the hospice approach. And hospice approach is kind of an overarching philosophy, but there are all kinds of hospice centers as well, and so there's huge variability in what hospice looks like. But essentially the idea of hospice is to provide support for a terminally ill person and their families, and the focus here is on quality of life, again, rather than extending the length of life. So hospice approach views patient and family as the main unit of care. They try to meet the physical, emotional, and spiritual needs of the person who's suffering. Most hospices consist of an interdisciplinary team, so you'll have things like doctors and nurses, but there often will also be a religious figure, some sort of chaplain or priest that's meeting those religious or spiritual needs. You'll often have a counselor or social worker that's helping deal with sort of the emotions and the coping styles. And then there's also sort of teams that are geared more towards helping the family with the grieving process. And so it's not as much like a hospital where you just have doctors and nurses. It's a more sort of holistic approach. It's often, the goal is to carry it out either in the home of the person or at least a more home-like setting. So rather than the sort of clinical setting that you get in a hospital where it's white walls and the blue sheets on the bed or whatever, it's a more comfortable home-like feeling to it. They focus mostly on palliative care, or which is sometimes called comfort care, and really that's medications or therapies that are used with really the only goal is to reduce pain and promote quality of life. And so again, that's opposed to something like if you have cancer and you get chemotherapy, that's probably going to extend your life, but it's going to significantly reduce quality of life because you're going to be sick, you're going to lose hair, you're going to have all these side effects, right? Palliative care would be the opposite of that, where we're going to give you medications and things that are going to reduce your pain. They may not extend your life, but they're at least going to make the last few months or years of your life better. Most hospice approaches have regular visits and 24/7 on-call services, and they also, like I said, provide bereavement or grieving services for the family members once the terminally ill patient has passed away. There's over 6,000 hospice programs in the U.S. They serve about 1.2 million terminally ill patients, and about 67% of those have been diagnosed with some sort of terminal cancer. Let's see what is on here that I haven't said. Hospice can often be a more cost-effective alternative, so the costs of hospice care are often a lot less than the costs that would be associated with trying to extend the person's life. And it is covered by most healthcare providers, so like Medicare and Medicaid cover it, and then most private health insurers do as well. It's been shown to contribute to improved family functioning overall. Minorities are much less likely to participate in hospice than Caucasian families are, and so there's some hospices that are trying to develop more culturally sensitive approaches to try to reach out to ethnic minorities, and there needs to be greater access in developing countries. It's a lot less common in developing countries than it is in industrialized nations. All right, so here's where we come back to the other sense of the phrase death with dignity. So as I said, death with dignity is this overall kind of philosophy, but it's also a law that is instituted in several states. And these laws really revolve around giving people options to essentially end their life whenever they're diagnosed with some sort of terminal illness. And again, kind of like defining death, it's been a highly debated topic. There's a lot of controversy over some of these practices. But just as an example case again, how many of you have heard of Brittany Maynard? It's a much more recent one than Terri Schiavo. You might be familiar with the ones I describe it. So in 2014, Brittany was diagnosed with a terminal brain cancer. I don't remember her exact age. I want to say she was around 23 or 24, so very young. And she was otherwise really healthy, had a really great life, but was diagnosed with this terminal brain cancer. And she decided that she did not want to deal with all of the burdens that come along with that. She was, pretty much as close to certain as you can be that she was going to pass away pretty soon, and had little control over that. And if she chose to kind of fight and try to reduce the cancer or recover from it, then it would have been really financially difficult. It cost a huge amount of money to do that. And she also felt like it would be a massive emotional burden for herself and her family. And so she wanted to basically take control over her death. So she moved to Oregon. Oregon was one of the first states that instituted what's called this Death with Dignity Act. And basically that act allows for these first two categories to happen. So ending life-sustaining treatment is legal in, I think, pretty much all of the US, but medical aid in dying is only legal in Oregon and 8 other states. So ending life-sustaining treatment is where, kind of like with Terry Schiavo's case, where you have someone who's on a life support system, and if you take them off that life support system, then they pass away. And so doctors can withhold or withdraw treatment, permitting the patient to die naturally. Medical aid in dying is where you have an incurably ill patient can be given a subscription for a lethal medication that they can then take themselves. It's sometimes called physician-assisted suicide is the other term for it. That one obviously has sort of more negative connotations than medical aid in dying does, so most people who practice this prefer this term. Medical aid in dying, so like I said, it's legal in states like Oregon and a few others. But there are a lot of restrictions to it. So first of all, you have to be incurably ill. So you have to have a terminal illness that has been shown to have no cure. And I think there's even a limit that it has to be a terminal illness that the doctors have said you will die within 6 months. And then there's this whole process that someone has to go through in order to get the prescription. So first of all, they have to have 2 doctors sign on and agree, and then they have to first give oral request for the prescription. After the oral request, they have to wait, I think, 15 days, and then they have to provide a written request if they still want to follow through, and then after the written request, they have to wait 48 hours before they're actually given the prescription. So there's a lot of measures taken to make sure that the person is in the right state of mind, that they really want to do it, that it's not just an impulsive decision, and also that multiple doctors agree to it. So Brittany Maynard did decide to do that and ended her life in, I think it was in 2014 or maybe 2015. And she passed away, sort of in the comfort of her home, surrounded by people she loved and cared about, still kind of at the top of her mental capacity, so she didn't really have any declines before she passed away. So that's medical aid in dying. Voluntary euthanasia is similar. It's just where the doctor administers the drug themselves. So medical aid in dying, the doctor's prescribing it, but the patient takes it. Voluntary euthanasia, the doctor themselves is actually administering the lethal medication. Right now, voluntary euthanasia is technically illegal in the US. There have been some cases of doctors who have gone through and done it, and they typically get pretty lenient sentences, even though it's illegal. And then there's involuntary euthanasia, which of course is illegal in all of the US, and I think pretty much every country. My laser won't turn off. So involuntary euthanasia is where the doctor ends a patient's life without the patient's consent, which, like I said, is illegal. One of the arguments, though, against voluntary euthanasia is that there may be this kind of slippery slope that leads to involuntary euthanasia. Basically, if you give doctors the legal right to end patients' life, then they may abuse that power and end patients' life even when there's no consent. But there have been, I think, the Netherlands and Belgium are maybe 2 of the only countries that have legalized voluntary euthanasia, and they actually saw a decrease in involuntary euthanasia whenever they legalized it. So that argument that it might do this kind of slippery slope, probably, at least based on research in those countries, might not be an accurate argument. Again, still a lot of controversy around a lot of those. One way to kind of ensure that you maybe don't have to deal with some of these issues like Terry Schiavo did is to create what's called advanced medical directives. And these are basically legal documents that you can have written that dictate what you want to have happen if you find yourself in a situation where you're in persistent vegetative state or something like that. So it's a written statement that describes medical treatment in case of incurable illness. A living will is a document that specifies the desired treatment. So you write down, okay, if I'm ever in a persistent vegetative state, I want to maintain life support, or I want to have it removed. Or, you know, if I'm diagnosed with an incurable illness and I can't make decisions for myself, I want to have X, Y, and Z happen. You can also do what's called a durable power of attorney. That's where you designate someone else to make those decisions for you. And right now the laws, like if you don't have a power of attorney, the laws on what happens kind of vary from state to state. So it could be that that decision falls to your spouse. If you have a spouse, it could fall to other family members. But in some cases it might not fall to any of those. It might fall to the physician or someone who's sort of in charge of your care. And so I think it's a good idea for everyone to maybe have a power of attorney, even if you have no thought whatsoever that you'll be diagnosed with a terminal illness. You never know what could happen, and so it's always good to have just sort of some safety measure to provide directions on what you want to have happen in those extreme situations.